Hey, Jean-Claude. How are you doing?
Good. How are you?
I'm well. Thanks for doing this. It's so good to see you.
Yeah, absolutely. Good to see you, remote as that may be.
So thanks again for doing this today. For those of you that don't know Jean-Claude, he's a very dear friend of mine with a ton of background in healthcare. So we actually met through the HIMSS community years ago when he had just taken this new job at Wolters Kluwer, but actually had been in the healthcare industry for, how many years before that?
Yeah, started 2005.
2005, yeah. So big background with Cardinal Health and a lot of other big brands that you guys will know. We'll talk about that a little bit more. But specifically with his role as CTO at WK, he is responsible for driving the next generation of technologies to improve healthcare and reduce variability in care, which is something Jean-Claude is very, very passionate about. So we'll talk about that a little bit more today, and specifically how he's really been able to drive digital transformation forward and impact variability in care as the COVID pandemic has really changed the industry. With that, Jean-Claude, I would love for you to add anything else and tell us a little bit more about your experience from starting healthcare in 2005 to where you are now.
Yeah. So glad to be here. Dial it back maybe a tad bit before that. Sort of background is in technology, mechanical engineer by degree, bachelor degree. Then I sort of got my master's degree, and then over time I sort of switched from sort of mechanical engineering into the software world, into systems engineering. And then, I've sort of worked in different industries, but at some point I wanted to pick sort of an industry I'm passionate about, and healthcare was one. So I got into healthcare in 2005. It was with back then a very small startup called Wavemark out of the Boston area. So what we tried to do is create a RFID-enabled data network that allowed hospitals and medical device manufacturers to manage the supply chain of medical devices from manufacturing all the way to implant to patients. Then we expanded sort of beyond the US, we expanded internationally. We were in Europe, we're in Asia. It was a great time. And then that's where we met around that time. So 2017, I left Wavemark, I joined Wolters Kluwer Health. So, through that journey, it was great going from a small company to a large Fortune 50 giant, right? And great learning experience for me, knowing how to function with speed in a small company, but also how do you function with speed in a very large corporation.
So Jean-Claude, I know you're a very passionate person, and you've been in healthcare for so long because you really like to see that industry move forward. So can you tell us about how specifically you're doing that at WK Health and what your passion is aligned to actually moving forward with your patients?
So our mission is to ensure that actually we will function across the entire continuum from clinicians to patients, and ensure that clinicians, whether it's sort of doctors, nurses, techs, even upstream, whether they are medical students or nursing students, as well as patients, are informed with the most up-to-date information, and that information is as much as possible personalized to them, contextualized to them, and enables them to make the best decision possible.
So we met at HIMSS years ago. It was a great event. I mean, that show gets really overwhelming really fast, but you meet a lot of really cool people, see a lot of really cool things. I want to hear a little bit more from you over your years in the healthcare industry. How have you leveraged groups like HIMSS or even more clinically focused groups to help move your career forward and to make really connections to actually advance what you're looking to do in the industry?
In health, nobody has the end-all be-all solution in healthcare. It's through partnerships that solutions come to fruition, right? Because, whatever you have as a solution, you need to integrate in a workflow, you need to connect it with somebody else's solution, you need data to power it, you may have some of the data, not all the data, you need to provide alerts that are run by another solution. So what I love about connections that we make through HIMSS, for example, is that they allow us to meet and envision a better healthcare world for our patients and our clinicians.
Jean-Claude, now I want to talk a little bit more about your day-to-day and the impact you're making at WK Health, specifically around this artificial intelligence center of excellence you've told me a little bit about. Can you give us an overview of the vision from that and how you've built it from really nothing to what it is today and the impact you're making for digital transformation at WK?
Well, a colleague of mine uses this thing of like, we fall in love with our products, right? And then we make our products the center of the world and everything revolves around them. And with this approach, we actually turned it around and we said, customers are the center of the world, right? Patients are the center of the world. Everything else is going to revolve around them. How do we go and tackle problems that need to be solved? An advantage we have is that we have, because we have a lot of clinicians as part of our team, we're able to put clinicians and technologists side by side tackling the same problem. And what we focus on is an area that we're calling augmented intelligence. And in augmented intelligence, the idea is that, and I think that's a sweet spot of AI in healthcare. It's actually where AI comes in to augment the capabilities of the clinician.
Well, it sounds like you're getting the buy-in from the clinician early on too. They're like, oh yeah, this sounds cool. If you did it this way, it would be more impactful in my workflow. And then they're already on board to help actually make it come to life. Exactly.
And it's actually beyond buy-in, right? It's more, you're getting engagement, right? You're getting clinicians to say, oh, yes, let us solve that problem. I see what you're doing. Let me help you with clinical information, make data science decisions so that together can join and create a better solution.
Yeah, this comes back to what we were talking about earlier of how you stay engaged with your customer and also the patient. It sounds like right there, when you're creating AI capabilities, they're at the table and they're getting a say, and that's going to actually take you way further down the road and actually move this digital transformation forward.
Exactly.
Jean-Claude, you've been in healthcare a long time. So you and I both know it is one of the most regulated industries. HIPAA, high trust, something new, it sounds like every 6 months or so. So I'm curious, your experience and as you're with groups of HIMSS and these other groups that you network in, what are the more striking security challenges that you're seeing amongst your peers across the healthcare industry?
So it's not a technology problem, right? It's a business problem. It's everyone's problem. So number one is, how do you create a security culture in the entire organization? And it was a journey to get here, but actually when we got here, it's pretty good because you can now feel that it's not only security people who talk about security, right? It's actually everyone's talking about security. Everybody worries about security. Security is in the roadmap. Security is in what we do, in the architecture, etc. So that's the good part, right? The challenging part is once you get here, is that you need to continue pushing forward, right? Sort of bad actors keep getting more sophisticated. Technology of bad actors keeps getting more sophisticated, and you just need to be on a continuous sort of evolution path, with your security mindset.
Jean-Claude, we're living in very interesting times, and current topic, I know, right? You're in your home office right now. So a current topic I'm talking about a lot on these digital drive conversations is what's going on with COVID-19 and how that's impacting your business. Can you tell us a little bit about how that's impacted your group within WK Health and how you guys have overcome some of the challenges to be still really effective during these little awkward times?
Sure. Definitely interesting times. So I dialed this back to March, right, of a few months back. And we were in a very interesting situation because we needed to react to this whole work at home situation. At the same time, our customers, people who use our products, are the frontline clinicians. And we, so we need to have their backs, right? We needed to make sure that we have our most up-to-date COVID-related content available, updating it all the time. Information was changing all the time. It was a new disease that was still being learned on. So we had a sort of, I'd say, the combination of two challenges. One is functioning as an organization, just like all organizations out there, right? How do you work from home? How do you dial in, video and so on. The second challenge is we couldn't miss a beat because we needed to be there for our users because they needed to be there for our patients and ourselves, right? So I think that was probably the most challenging part of it. It's that beginning. At the same time, it's actually when you know what you're doing and why you're doing it, everybody gets this sort of extra, sort of boost of energy, because you know that what you're doing matters, and it matters to do it as fast as you can. Ask the questions. Are you okay? Are you okay now that school is starting? Are you okay now that summer is starting? Etc. And because people may not be okay, so how do you create an environment or a schedule, etc., to make them be okay? And also, it's okay to show as sort of leaders to teams, it's okay to show the flaws and the cracks. And, if I'm, doing in a meeting and, the kids walk, that's okay, right? There's background noise, it is what it is. And by showing that these things are acceptable and that sometimes you can do video and other times you cannot do video, that sets an example to the team that things are acceptable.
How about from a patient perspective? How do you think this is going to impact people going to the doctor when they're not extremely sick and being just hesitant and cautious about the spread of, the virus within a hospital, for example?
Yeah, so there's a big spike in telemedicine and virtual care. It started, with COVID. It sort of spiked, it went back down a bit, but it settled at a rate that's way higher than it was. And it's sort of this accelerated adoption curve, right? It would have taken us a decade to get to where we are today. I think that ecosystem is still missing pieces. And that's actually what we're working on. That's what others are working on, sort of still missing pieces to make it sort of function optimally. But when virtual care can function optimally with, again, a few pieces sort of added to it, it'll make care, so access to care actually easier for patients.
And I would think can help control the variability too, right? There can be a more consistent model, consistent delivery across different platforms and to different patients that is helping solve your ultimate goal.
Exactly.
You are in the healthcare industry where a lot of times there's expectations that you care about your health. Other times, some people don't. But I'm curious how you live your brand, especially because you've been in healthcare so long, and how you are really aware of your own health and fitness and how that actually impacts your day-to-day and helps you be successful in your career.
So there was one thing that was constant throughout, before COVID and after COVID, is that the alarm on my phone is set for 5:15. It was set for 5:15 before COVID. It's set for 5:15 now. And that's probably the only part of my daily routine that hasn't changed, which is 5:15 alarm rings, and then I get a workout done, and then coffee, catch up on the day, and then start my workday. Tend to, not to put a sort of an ad plug here, but either Peloton or like an indoor rowing. Tend to do a bit more indoor rowing, but sort of one of these two. But that's sort of my start of the day.
Jean-Claude, I have a consistent question I like to ask a lot of folks who come on the show, and that's around principles. We talked about earlier how WK has principles that you guys live by to be successful. I want to hear specifically from you, what is the guiding principle that you live by in business that's helped you be successful?
Sure. And, if you've seen these in my presentations, if you're watching this this show, then you know what they are. So there's 4 principles, and they're simple, and actually, they're not only in business. It's actually, sort of everywhere. I try to live with, with them in normal life. Speak the truth. Deliver on your commitments. Treat others the way they want to be treated. And whatever you do, do it with speed and passion. And, I do that in business. I do that in fun. I do that sort of wherever, my kids live with that, by that. And, it's sort of a good sort of rallying thing on the things that matter. And, most people on my team sort of know these four.
So where do these principles come from?
Yeah, so I borrowed them. Actually, the first three I borrowed from a colleague of mine. I saw him present them. They inspired me. And I said, okay, I'm going to sort of live by those, but also, project them to sort of my teams and adopt and push them forward. I added the fourth one around the speed and passion. And now it's been, they sort of feature in how I communicate with my teams for probably the past 7 or 8 years.
Well, Jean-Claude, this was a lot of fun today. Thanks for participating. Really enjoyed the insight you had to share. Love to see your passion for the industry, your passion for what you're doing, and really excited to see the advancements that you're going to make in the healthcare industry. So thank you so much for sharing.
Yeah, thank you for having me here.
Well, we'll see you again soon, either in New York or Boston.
Absolutely. Take care.